Hi everyone, my name is Mary Mark. I'm here to do my PowerPoint presentation, and my topic is on depression. And I chose depression because I have had an experience with depression in my past many years ago. I am thankful that it has been many years ago. Throughout the process, I was really, really blessed to have a very, very good mental health counselor who helped me through this dark, dark place that I was in. And with that being said, what is the definition of depression? So, depression is defined as feelings of despondency and dejection. um, it is a mood disorder which causes sadness, loss of interest, feelings of guilt or low self worth. It disturbs our sleep or appetite and poor concentration. It affects how we think, how we feel, how we behave, and it can lead to a variety of emotional and physical problems. What are the different causes of depression? So, depression is not caused by any one thing in particular, but it's a combination of things. So, it is said that depression is viewed to be the result of interaction between several forces such as genetics, medical problems, medication, stress, and neurochemical imbalance. Um, what is implicated here as well is the deregulation of the hypothalamus pituitary adrenal axis in the causes of depression. There are some neurotransmitters also which has been implicated as having significant role in the onset and maintenance of this disease. And these neurotransmitters are norepinephrine, which is responsible for energy, metabolism, mood, anxiety, and focus. We know it as fight or flight. There is serotonin, which is responsible for sleep cycle, mood, appetite, arousal, memory, impulse control, sexual desire. It is called the feel good hormone, and there's dopamine, which focuses on attention, memory, motivation, and mood. Or the effect that depression has on the body is listed here, and what it says is that there's overwhelming sadness, there's cognitive changes, certainly in a negative aspect. There are weight problems, there are constriction of blood vessels, so that there are physical and physiological changes that really goes along with depression. What are different types of depression? So there are a few types of depression, but I have chosen to speak on four. The first being major depressive disorder. The symptoms of this disorder includes loss of interest, loss of pleasure, weight loss, weight gain, lack of energy, thoughts of death, and or suicide. Dysthymia. The symptoms are depressed moods that last for at least 2 years, and individuals with this disease may have episodes of major depression along with periods of less severe symptoms. The psychotic depressed individual experiences severe depression along with psychosis. And delusions, which are false beliefs, and hallucinations, which are um, hearing and seeing things that are not present. Postpartum depression are experienced by women, of course, after childbirth, and those who experience this type of depression experience extreme sadness, anxiety, and exhaustion. And these negatives interfere with their ability to function and to complete daily activities, both for mother and for the baby. So, who is affected by depression? Depression affects anyone and everyone. It is a pervasive disease and it affects men and women, young and old, irrespective of race, of age, of sex, of culture, and socioeconomic background. It often begins at a young age and is usually accompanied with symptoms of anxiety, which includes fear, rapid heart rate, and, oops, my goodness, hyperventilation. More women than more women than men are affected by this disease, and more Caucasian women than any other race are affected. Worldwide, over 350 million individuals are affected by depression, 15 million of which are Americans. At its worst, depression can lead to suicide, and it has been noted that over 1 million people commit suicide per year, and this has been calculated to about 3,000 suicides per day. So what are the signs and the symptoms of depression? Some of them include depressed mood nearly every day, diminished interest in pleasure in all or most activities, significant change in weight or appetite, insomnia or hypersomnia, fatigue or loss of energy, psychomotor agitation or retardation, feelings of worthlessness or guilt, diminished ability to think or to concentrate, and last but not least, recurring thoughts of death and or suicide. How is depression diagnosed? The tools necessary in the diagnosis of depression include Beck Depression Inventory 2 and the Center for Epidemiological Studies Depression Scale. The client is given a list of multiple choice questions, and the response to these questions are used to assess the severity and or diagnosis of depression. What also is required is that there are 5 or more symptoms, and they must be present for at least 2 weeks. One of these 5 symptoms must include being in a depressed mood for most of the day, or diminished pleasure or interest in all or most activities. So again, one of these 2 must be present in the diagnosis of depression, and the symptoms must not be related to substance or general medical conditions. How is it treated? Well, first of all, most patients with depression are treated by the primary care physician, except for in severe cases where they would be referred to a psychologist, a psychiatrist, or a mental health profession. However, due to the stigma attached to depression and other mental health disorders, many people, for this reason, due to the stigma and undiagnosis, or for other reasons, go undiagnosed. And unfortunately, some of those who are diagnosed receive inadequate treatment. And what this does is lead to a continuance of depression. The different modes of treatment include pharmacotherapy, psychotherapy, and exercise. Yay for exercise. What effect does the treatment of depression have on the body? So the medicine uses antidepressants, and it is widely used in the US in the treatment of moderate to severe depression. There are, however, unwanted side effects like with all medications, and also the inconsistency of adhering to taking these medications leads to early discontinuance, and what this does is lead to recurrence of depression. There's psychotherapy. There are 2 types of psychotherapy. There's cognitive behavioral therapy, and there's interpersonal therapy. In cognitive behavioral therapy, the clients learn to identify cognitive distortions or maladaptive thoughts and realize that they are irrelevant, they have no place, and they are redirected to replace them with positive and more relevant thoughts. Likewise, with interpersonal therapy, the clients are helped to identify interpersonal problems, and in collaboration with their healthcare provider, they create new ones and learn to adapt to these more rewarding interpersonal behaviors. So what effect does exercise have on depression? Well, apart from all its wonderful benefits, it has been noted that aerobic and resistance training can also reduce depressive symptoms in patients with major depressive disorders. Like this picture said, this one says that exercise is the most potent and underutilized antidepressant, and it's free. This one states that exercise builds strength, it gives us confidence, it gives us happiness, it boosts our happiness, and it increases endorphins that also leads to happiness. Whereas this one says that exercise reduces depression. Yay for exercise. In my case study, my client is a 56-year-old African-American female who is very unhappy in her life situations. She has no energy, is in bed throughout the day, no exercise in the past 2 years, unhealthy eating habits has leaned to an additional 70 pounds. So she's not only overweight, she's obese. And she's overwhelmed with personal issues and experiencing joint pains. Her blood pressure is 120/80. From a medical history perspective, she is taking Lipitor for dyslipidemia. She has a family history of myocardial infarction. Although her dad died at 60 and her mom at 80, her brother died at 29. And she also has a brother at 62 who has a history of diabetes mellitus. Risk stratification. So after taking into consideration all these factors, she has 4 positive risk factors and 0 negatives. She's therefore classified as moderate. Her goals are to modify her eating habits, to begin facilitating weight loss. She also wants to begin moderate exercise such as walking to also help in weight loss. She needs to consult her doctor about pain and also how she feels, and later on she has intentions of returning to the gym. Okay, in careful consideration, all of these are not health risks. What I thought about in exercise testing is the fact that she has lack of energy, she has no motivation, she has not exercised in 2 years, and she is experiencing pain both in her knees and in her wrist. She's obese and is fully aware of her body image. So therefore, the mode of exercise I chose to use for exercise testing is the treadmill. This equals walking. For her exercise prescription, again, I took into consideration all her factors and decided to start her off with walking. So according to the FIT principle, she's going to start walking 3 to 5 days a week with the intention of progressing to 7. The intensity is moderate. The time is 20 to 30 minutes to start, and hopefully she would be able to increase to 45 to 60 minutes a day. The type is walking or stationary bike. Later, resistance training would be implemented, and then she can use like machines or free weights and so forth. In conclusion, what I have found is that depression is an illness and not a choice. It affects millions of people worldwide, and we as a people are responsible for the stigmatization of depression and other mental health illness, and therefore should be responsible for removing that stigma. No one should be ashamed about depression, but rather should seek the resources necessary for health and for well-being. So therefore, if you know someone who exhibits symptoms of depression, reach out to them, let them know you care, and provide available resources. Talk to them about exercise as medicine and extend help or companionship as their first line of resource. With that being said, this ends my PowerPoint. I hope that some insight was gained on depression and that we would be attentive to others, show them that we care, and be that first line of support. Thank you.